Okay, well, thank you, Robert, for that kind introduction. And it's so exciting to see everybody here, to be here in Denver for this first conference of our Extraordinary Kids Clinic. And it's so nice to see so many families that I did see in California or here in Colorado before, and then to meet so many new families yesterday and through the course of the conference. So thanks, everybody, so much for coming. I just want to tell you first a little bit about our clinic, and then I'll go on to talk about a lot of the research that Robert was talking about that we did at the Mind Institute and here in Colorado on developmental and behavioral issues in kids with X and Y chromosome variations. So, this is the Extraordinary Kids Clinic. And this actually came about, like Robert said, mostly from talking with parents and from talking with you guys who said, you know, we don't have a place. When I tell my doctor he has XXY, or when I tell my doctor she has XXX, they kind of look at me and they say, oh. And I ask them questions, and they don't have a lot of experience. And so there's a lot of endocrinologists who had had experience with Klinefelter syndrome, but the other disorders, parents didn't feel that they had a place where they could go to get questions answered. Oftentimes, parents felt like they were educating the physicians and the professionals and therapists that they were working with. So we wanted to change that and have a place where parents could come, where there really are a group of experts who've worked with kids with these conditions before, who don't look at you kind of puzzled when you say something about the difficulties that they might be having or the strengths that they're having and what they're really good at. And so that's what drove creating this clinic. And a lot of you actually participated in the building of the clinic in terms of working with us on a project. We did an internet survey where parents described all the services that their children needed and the types of services and evaluations and pieces that they needed for the care of their kids to be comprehensive. And so we appreciate your work in putting that information into our survey so we could actually piece together the clinic in the way that we felt was going to be most helpful to you. So the goals of the clinic are really mostly to provide comprehensive clinical care. So it's to treat and evaluate and do clinical care for kids with X and Y chromosome variations. And when I say kids, it's called Extraordinary Kids, but we actually see young adults as well, probably up to around 30, and if we followed you, we might follow you for longer. And so, and the comprehensive evaluations include medical evaluations. We want to make sure we're addressing behavioral and emotional issues. We want to make sure we're addressing all the educational concerns, motor skills and motor deficits that we see difficulties in sometimes. And then also the prenatally diagnosed group where they're diagnosed before birth and problems haven't necessarily evolved yet, or they might not actually show a lot of problems, but we want to do close developmental follow-up to make sure if problems arise that we are treating and getting kids into therapies when they need them. So that's the first goal, is really clinical care. And then this also lends to the second goal, which is a really nice opportunity to do a lot of continued research. When we have clinical patients coming in, we can do a lot of clinical research and a lot of basic science research as well in conjunction with the clinic. And then the third goal is really to provide education as well. So that's another piece that the parents always told me, Nicole, no one knows anything about this. How come doctors didn't test earlier? How come no one knew about it? The teachers have never heard of it. And it's so common. And so part of the goals of the clinic is actually to educate professionals and students who come through. So we have residents, pediatric residents who will come through the clinic, trainees in all the different areas that we want to attract through. And so it's going to be also a place where professionals can learn about the X and Y variations. So these are the members of the clinic. This is me, the director, and you've heard a lot about me, but I'm a developmental behavioral pediatrician by training, and so I do a lot of basic medical care as well as evaluation for developmental and behavioral types of issues and medications that are needed for those types of problems. And this is me. The picture on the bottom with all those boys, that's where it all started, was at the XXYY symposium that was here in Colorado in 2004, I think. And so that was me with a big group of XXYY guys, and it's been uphill, I guess, since then. These are the two child psychologists in the clinic. We don't have a great picture of Rich on the bottom, but if you see him, when you see him tomorrow, that's what he looks like. And so Rebecca Wilson, Dr. Wilson is our first one, and she has been in the field of child psychology for a very long time and worked with children with all sorts of different genetic disorders, including Fragile X and 22q deletion. And so she was a very easy selection in terms of when we started talking about the psychology needs for the clinic here. She does a lot of work with children in terms of social emotional problems and behavioral difficulties, as well as educational problems, and then developmental assessments as well in the younger kids. And Rich is an expert in learning disabilities. He trained under Dr. Bruce Pennington, who was one of the first psychologists to describe the reading disabilities in males with XXY. And so he has excellent training in identifying and treating reading disabilities, and he's going to be talking about that tomorrow, and also in terms of neuropsychological functioning and executive function. Sid Martin is our occupational therapist, so she deals with problems in terms of motor skills and motor planning, as well as sensory processing difficulties. And so it's really valuable to have her on the team as well. And then Jackie Frazier is our speech and language therapist, and she also has been at Children for many years doing evaluation and treatment of children with all different types of disabilities. And it was actually very nice when I went to talk to the speech therapy department here, and I said, you know, I'm really looking for someone who has maybe some experience with this. Jackie said, oh yeah, I've actually treated a guy with triple XY for a long time. I know all about it. And so she was, you know, she'd actually had experience treating and working with kids, and so she has a great grasp on the speech and language difficulties in these kids. And then Dr. Zeitler is our endocrinologist, so for the boys who need testosterone replacement, and also for other kids who might have other endocrinologic issues, such as growth problems or diabetes or thyroid problems, obesity. He has a lot of expertise in research and clinical care in those areas. So we collaborate to do testosterone treatment. He's the endocrinologist who does the treatment, and then we collaborate together in the clinic. And then last but not least, and one of the most important pieces, is Susan Howell, who is our genetic counselor and our clinic coordinator. So she's the first point of contact that many of you guys have called to be involved in the clinic, and she helps coordinate and get all the paperwork and records together, and then helps get the family scheduled and set up. She's also involved in the evaluations, and she's a genetic counselor as well, so she can provide a lot of good input in terms of genetic counseling and genetics advice as well. Okay, so this is a little bit, people always ask me how it works and what happens. So I'm going to tell you a little bit about it. So first of all, for the evaluations, if people are interested, you first call Susan Howell, and the number is here, and we have flyers there that people can take with the number of where to call her. And then Susan will then talk with families first over the phone, and she collects the background information and the concerns about the child or the young adult. And then Susan will send some, other questionnaires and intake packet to the family. You guys send it back to us with other records that we work on collecting as well, if we need previous records from genetic testing or from school evaluations or psychology evaluations. And then once we get all that information together, then we call you back and we arrange the components of the team, the people on the team that you need to see, and then also when you're going to come in. So that's kind of the logistics of how it all works. The evaluations take anywhere from 2 hours to 2 to 3 days, depending on the age of the child or young adult, and also on the need for the different types of assessments. Sometimes it's quick and just needs to see me, or sometimes it's a much more comprehensive evaluation that we do. We do the full team evaluations once a month, and we're working on increasing that to twice a month. And then we also do other follow-up evaluations scattered throughout the month. We also do the infant follow-up anytime during the month as well, from 0 to 3 years of age. And then, people say, well, how often do we have to come? And, this is your clinic. You guys asked for this, and you requested a place to come, so you come when you need to come, and however often you need to come. So you can come once a year, you can come just once and get an evaluation, you can come every year. So it really depends on your needs and your wants and the services that you have also in your state in terms of follow-up care. So, like I said before, we welcome adolescents and young adults as well. I think it's a hard, we're going to do a lot of talking at this conference about transitions from childhood to young adulthood, and so we want to be able to provide that continuity of care during that transition time. And we also work with outside people. So if you have an outside endocrinologist or other people on the outside, you don't have to receive all your care, endocrinology care here. We can be consultants, and we can also be, just give advice and work very closely with them in terms of problem solving as well. We do a lot of communication with the primary care doctors because they are still, we don't do primary care at the clinic, immunizations and those types of things, but we want to really maintain good communication with the primary care doctors so that they can call us if they have any questions or concerns at any time. And we can also call them if we need them, one of our patients, to have a medical advocate or medical care provided in the primary care setting. And so other people ask, well, how much does it cost? And, do you take insurance? Well, we definitely take insurance. We take medical insurance of all kinds, and we take Medicaid. And we have an insurance woman who basically gets all your insurance information, finds out what's covered and what's not, and then we can, determine which evaluations are covered by insurance. If they're not covered by insurance, the hospital has a self-pay agreement where if parents are paying for the evaluation out of pocket, then there's 35% off of what we would otherwise bill the insurance companies. So, and then we have some future goals too. We have a big team and things that are going well, but we have some pieces that are still missing. And one of the things we're working on is something called the Connections Program, and it's a program we're working on fundraising right now with the XXYY project. And this is to add someone who is a social worker and a case manager in terms of when we finish and make a big set of recommendations, that we help you then connect with those services that are needed. So if we say, we really think it would be great if he had a psychologist in California that could help work on these things, this social worker could help identify who a good person would be and really get our recommendations implemented wherever the patients are. And that, I think, is really important, because that's where sometimes if that falls through, then, our recommendations and our expertise doesn't really translate into good care for your child. We're also working with the University of Denver, who are helping us with the school liaison. So this is more for the local families, but this person could also call and work with school districts from out of state. And this is a person who is going to be there, who is training to be a school psychologist and supervised by a school psychologist, Karen Riley, who is one of the psychologists who will be speaking here also tomorrow. And this person will actually be a liaison between the schools during the IEP process or any problems in terms of the educational setting, so that this person can kind of help translate what our recommendations are, go to the schools if needed, really help translate some of our recommendations into a good educational setting for the kids. And then we also are building our community advisory board, which will be made up of really you guys, selected people from here that can help us make sure that our clinic is functioning the way we want it to, that people aren't having concerns about the way it is, and that can help us build programs and make recommendations for improvements. So, and then there might be some other, people that we need to have involved in the future. The dental clinic is very interested in being involved, and there's a lot of guys who have, and girls who have dental problems, and they specialize in some of the more rare dental difficulties that these kids have, and then neurology, and also for the XXX girls, I think there's a big need for adolescent gynecology, and this is another service that we do have here at Children's. And we also want to, hopefully in the future, not be able to just do consultations, but also to be able to provide ongoing behavioral therapies. When we say, we really think he needs some therapy for his anxiety, or we really need, think he needs some extra special help in reading, that we can actually provide those services as well in a specialized manner. And then our research goals, I'm actually going to, I think, skip this part because, well, let me talk about them. So these are our goals, and I'm going to go through these pretty quickly because I don't want to run out of time in order to go through my real talk on all my research. So the short-term goals of our research are really to still continue to better characterize the medical and psychological features of the X and Y variations. So to understand the strengths, understand the weaknesses, and to really understand in all kind of aspects how they all interplay with each other. And so we're still doing a lot more work on the developmental features, the associated medical problems, the learning disabilities. Rich Boada is really interested in saying, are these reading disabilities in XXY the same as the reading disabilities that we see in typical kids with dyslexia? Are their patterns the same? So then will the treatments be the same, and will the interventions be the same to be able to help them with reading skills? we want to look at executive functioning, and we're going to talk a lot about what executive functioning is, and then looking at the social emotional difficulties. We also are still going to continue to, we've started some work in California, but to look at the genetic factors. You know, we know the kids have an extra X or extra Y, but we don't know the genes on the X and the Y that are related to the neurodevelopmental differences, and we want to learn about those. And so we're doing some studies that are going to help us better understand those genes. And I'm going to skip through this. And then we also are doing a study. A lot of parents come in and ask, oh, you know, what's going to happen to his behavior when he starts on testosterone when he's an adolescent? Or, you know, what's going to happen to his motor skills? Is he going to get stronger? And this is a big question that a lot of parents have. And so what we are going to do is we're going to actually study patients who are adolescent age. So this isn't the prepubertal patients like Dr. Ross is studying, but patients who are adolescent age who are, you know, hypogonadal and testosterone deficient and who need to be started on testosterone. And we're going to study them, study their behavior, their cognition, their strength and motor skills before and then after starting testosterone treatment. There's other individuals who have who might have some underlying behavioral difficulties, and parents run into resistance. Oh, if he's, you know, if he's having behavioral difficulties, we don't want to start him on testosterone because it might get worse. And so, and we actually don't think it gets worse. You know, our hypothesis is that it doesn't get worse if it's treated appropriately. It at least doesn't worsen that. Sometimes it actually gets better. So we want to work on better understanding what happens to the behavior and the cognition when we start testosterone. And then our long-term goals, you know, everyone says, well, we want to increase, you know, how come we weren't diagnosed earlier? How come, you know, 75% of males with XXY are never diagnosed, or 90% of males with XYY are never diagnosed? And that is something we want to really work on, is increasing prepubertal diagnosis of the conditions and better and in identifying the factors that are going to help us change how kids are tested so that they're actually identified earlier and receive treatments that they need. And then the last thing is we definitely want to do some intervention studies. You know, we have a lot of things that we make recommendations about, but we don't have a lot of evidence that some of these things really work. And if they do work, you know, what specific aspects of them are helpful in terms of helping with development or behavior. And so we want to do some studies in that way as well. And then this is the education and support. And so, you know, for the families that are local, we're also going to do events like this, not quite as large, but an educational event and a social event 3 or 4 times a year to really get everybody together so the kids can get to know each other, the parents can get to know each other in Colorado. Anyone's welcome to come from anywhere else, too, if you want. And so I just also want to acknowledge some of our funding for the actual clinic. The first funding for for a lot of my first salary support and research came from Bonfils Stanton, which is a foundation here in Colorado. And then the AAP, or American Academy of Pediatrics, funded the planning phase for the clinic. And then some of the ongoing funding for the support and the infrastructure of the clinic has been provided very generously by the Weckbaugh Foundation, which is another foundation here in Colorado, and the Hageman Charitable Trust. So these are very important contributors to the development of the clinic. And that's it. So